we're talking a little bit here about Medicare and Medicaid fraud, and Kat Mary Memphis has sent me this list of the 5 biggest or most egregious robbers, all corporations: Pfizer, Johnson & Johnson, GlaxoSmithKline, Hoffman LaRoche, and Sanofi Aventis. And as she points out, pharmaceutical corporations are the main source of Medicare and Medicaid fraud. Other notables are insurance and hospital executives who defraud Medicare and Medicaid and other federally funded healthcare programs. It just goes on and on. I mean, do any of these goddamn teabaggers or death panel freaks tell this to their brain-dead, empty-headed, slobbering idiots who show up for these rallies put together by the suicider and the pill popper and the whorehouse visitor? No offense to the sex workers, of course. Do they? No, they don't. And these gaggles of idiots that get together, I don't want any health care. Goddamn, just keep your hands off, keep the government out of Medicare. Just morons. Do you think Glenn Beck or the Pig Man would ever tell their sick audiences that real healthcare fraud is perpetrated by corporate America? Of course not. Anyway, GlaxoSmithKline, millions of dollars to settle allegations that engage in patent fraud. Johnson & Johnson, kickbacks. Pfizer, violating Wisconsin's medical fraud law. All right, now we go to Hoffman LaRoche. In 1999, that company agreed to plead guilty and pay $500 million criminal fine for leading a worldwide conspiracy to raise and fix prices and allocate market shares for certain vitamins. Jesus. Sanofi Aventis in 2009, that company, wholly owned subsidiary of Sanofi Aventis, the pharmaceutical line, acknowledged that it violated the False Claims Act by misreporting drug prices for patients in the Medicaid drug rebate program. They paid $95 million to settle the charges. In 2007, a special agent at the FDA's Criminal Investigation Office testified before the House Energy and Commerce Investigation Subcommittee that Sanofi Aventis had evidence that a safety study of its antibiotic K-Tech contained fake data, but submitted it to the FDA anyway. And it just goes on and on. It's corporate America that is just punishing the people in this country. Corporate America, where it concerns the weapons industry. Corporate America, where it concerns the private contractors that go to our manufactured wars. Corporate America that is supposed to be in charge of medicine for sick people, whether they're poor or old or both. Corporate America, where it concerns people getting loans or for a house. Corporate America, where it concerns people being charged a fair interest rate on their credit cards. Every goddamn place you turn, I defy any of you right-wing booger eaters out there to show me one example. Well, what about Acorn? Get out of here. One example where corporate America has not, in instances of massive fraud, where it was not a corporation behind it. And you dumbasses, you Republicans, you right-wing freaks who sit there and eat up all of this garbage, this swill that right-wing radio and television pumps into your mouths. You just sit there like these geese that provide pate. You sit there with your necks back and this huge funnel just churning stuff down your throat until your liver gets swollen and diseased. Ugh. I don't eat innards. Okay, it's opt-out is the good one. Prairie 2 writes, Harry Reid is pushing an opt-out plan where all states would be in for at least a year and then would have to justify to the voters why they are taking away their insurance plan. Opt-in would be a variation on the trigger plan that, oddly, Obama seems to back and would require each state to create their own plan. Okay, so I think opt-out is the one I would favor. And Reggie writes, opt-out is what they plan to include in the bill. Individual states can choose not to be in the public program, which means that if their legislature or governor and it's not yet decided who will make the decision, does not specifically opt out of the program, the people of every state will be in the public option. Individual states do not have to opt in to the program to be covered. All right, well then I guess opt-out is the one that I would favor, because it starts out where every state is in the public option, and then the governors and the legislatures, if they decide to pull out, would have to explain to their constituents why they're going to lose their insurance. On the other hand, the opt-in, like I said, the opt-in would be, I don't know about the trigger thing. Trigger thing makes me too nervous. It reminds me of the NRA. But the opt-in plan would be the public options available. Who wants it? Well, obviously, the blue states, so-called, would probably go for it. I can see states like Pennsylvania and Michigan and Indiana, states that have just been hammered with this created financial crisis in this country, created by the financial services industry. I can see those states opting in because of the desperate need for health insurance, and then having Republicans try to run and get elected, since all three of those states went for Obama last time, and trying to convince people to give up their public option. Oh yeah, that'll work. You dumbasses. So I guess either way has its advantages, right? Now, the Reuters news agency has a health and science editor, Maggie Fox, and she writes that the U.S. healthcare system is just as wasteful as Obama says it is, and proposed reforms could be paid for by fixing some of the most obvious inefficiencies, preventing mistakes, and fighting fraud, according to a report released on Monday. The report says the U.S. healthcare system wastes between $500 and $850 billion every year. That's a report from Robert Kelly, Vice President of Healthcare Analytics at Thomson Reuters agency or company or whatever. The report reads, quote, America's healthcare system is indeed hemorrhaging billions of dollars, and the opportunity to slow the fiscal bleeding are substantial. The bad news is that an estimated $700 billion is wasted annually. That's 1/3 of the nation's health care bill. The good news is that by attacking waste, we can reduce health care costs without adversely affecting the quality of care or access to care. Some of the other findings in the report, and this report was put together by Thomson Reuters, which is the parent company of Reuters news agency. Here's a couple other findings. Unnecessary care, such as the overuse of antibiotics and lab tests to protect against malpractice exposure makes up 37% of healthcare waste, or $200 to $300 billion a year. Fraud makes up 22% of healthcare waste, or up to $200 billion a year in fraudulent Medicare claims, kickbacks, or referrals for unnecessary services and other scams. Administrative inefficiency and redundant paperwork accounts for 18% of healthcare waste. Medical mistakes account for $50 billion to $100 billion in unnecessary spending each year, or 11% of the total. Preventable conditions such as uncontrolled diabetes cost $30 to $50 billion a year. Oh my God. Well, healthcare system wastes up to $800 billion a year. In 10 years, that's $8 trillion. What is the estimated cost of healthcare reform? Isn't it around $7 trillion? Oh, golly gee, goodness. You mean the entire thing could be paid for if the waste were wrung out of, and the fraud, especially the fraud? We all know that in a capitalist system there will always be fraud until there is the death penalty for fraud. or 20 years in prison, no ifs, ands, or buts. Look what they did to Bernie Madoff. What did he do? He ripped off a bunch of rich people and a bunch of rich foundations and a couple that weren't so rich. So he goes to prison for the rest of his life. What about this freak that ran Hospital Corporation of America? How much time did he serve? Crickets.